A Bachelor of Clinical Medical Practice is an undergraduate degree program that prepares students for a career as a clinical associate, also known as a medical associate. Clinical associates are healthcare professionals who work under the supervision of medical doctors, assisting in patient care, diagnosing and treating illnesses, and providing primary healthcare services. This video will explain how to get a Bachelor of Clinical Medical Practice and become a clinical associate in South Africa. Welcome to Brilliant Academic, the channel where we cover all things related to careers and academics. Here are the steps to becoming a clinical associate in South Africa. Meet the eligibility requirements. Typically, to pursue a Bachelor of Clinical Medical Practice, you need to have completed grade 12 or an equivalent qualification with subjects such as mathematics, physical science, and life sciences. It's essential to check the specific requirements of the university or institution offering the program you are interested in. Research and choose a program. There are several universities and institutions in South Africa that offer a Bachelor of Clinical Medical Practice. Research different programs, consider their reputation, accreditation, curriculum, and admission requirements. Some of the universities offering this program include the University of Pretoria, Walter Sisulu University, and the University of the Witwatersrand. Apply for admission. Once you have selected a program, follow the application process outlined by the university or institution. This typically involves completing an application form, submitting academic transcripts, and any other required documentation. Pay attention to application deadlines and ensure that you meet all the requirements. Complete the program. The Bachelor of Clinical Medical Practice program usually takes 3 years of full-time study to complete. The program includes a combination of theoretical coursework and practical clinical training. The coursework covers subjects such as anatomy, physiology, pharmacology, clinical skills, medical ethics, and public health. Clinical training. During the 3 years of study, students will undergo clinical training alongside their coursework. As part of the program, you'll be required to complete a certain number of clinical training hours. This allows you to gain practical experience in various healthcare settings under the supervision of medical professionals. Clinical training helps you develop the necessary skills to assess, diagnose, and treat patients. Graduation and certification. After successfully completing the program, you will graduate with a Bachelor of Clinical Medical Practice degree. However, to practice as a clinical associate, you need to register with the Health Professions Council of South Africa. The HPCSA is the regulatory body that oversees healthcare professionals in the country. You will need to submit the necessary documentation and pass the relevant examinations to obtain your professional registration. Continuing professional development. As a registered clinical associate, it is important to engage in ongoing professional development to stay up to date with advancements in the field. This may involve attending conferences, workshops, or pursuing postgraduate studies to specialize in a particular area of clinical practice. It's worth noting that the requirements and process may vary slightly between universities and institutions offering the Bachelor of Clinical Medical Practice program. It is advisable to consult the specific institution's website or contact the admissions office for accurate and up-to-date information. Click here to find out how much medical assistants earn. That's it, you guys. Thanks for watching. You check out my other videos, and as always, mischief managed.